There you go.
So I'm here with Izzy. Izzy is a 5-year-old Frisian and volunteered for me to demonstrate the massage strokes on her. If you give a massage, you have to set your goal. So you're either gonna release and relax the muscles in order to help them heal and rejuvenate. So you work on the joints and the fascia, or you're gonna activate and stimulate the muscles so you have a better performance and a smaller risk of injury. These are two completely different goals, but we use the same type of strokes and the same techniques. What we change is the intention, the speed, the depth, and the frequency. So those massage strokes we group in 3 different categories. We have the Effleurage stroke, we have the Petrissage strokes, and we have the Tapotement strokes. The Effleurage strokes are the strokes we use most in body work. We use them to palpate and to initially find connection with the horse. We use them afterwards to kind of address bigger areas within a gentle through stroke. You mostly go with the fibers of the muscle. It depends on the depth and the speed. If you go superficial and really slow, you can move liquid and you can move lymph and use it as a lymph drainage. If you go a little deeper, the stroke goes more into the fascia, and you can even put more pressure in to go deeper along the muscles. So that's the Effleurage stroke. Important stroke for transitioning in between treatments, initially to start the treatment and at the end to kind of help the horse integrate what we just did. Once you find the area which needs a little more attention, you go to your next toolbox. So you're going to use the Petrissage stroke. Petrissage strokes come in 2 ways. You have the strokes which create some compression, and the compression allows the tissue to melt under your hands and soften, or you use the strokes which kind of lift the tissue away from each other and create more space for the blood vessels and the nerves. I like those the best, so we start with those. If you stay superficially, you can grab some skin and then first pull on the skin and see the flexibility and create some space. If it's possible, you can go into a skin rolling either away or towards you. So that's called skin rolling, a superficial technique of the Petrissage stroke. If you want to do another superficial version of Petrissage stroke, you can go into vibration. You just start superficially and start moving tissue around. You can do that with the whole hand, or you can do a point vibration over a certain area and just wiggle and release the area. If you want to go more deep, you go into more, and then it's called shaking. So you address more muscles, and you can really release a whole area. The shaking part can also be used on the nuchal ligament, so you can shake the top and the front of the neck together with the lower area. Horses really like that. So that's the shaking part. Then when you go into another stroke of Petrissage, it's called pick up. It's similar. You show like on the leg, you kind of pick up the muscle, you pick it up away, and then you add a stroke to it. So you lift and pick up. That's a little more intense. You can see it goes a little more deep. Yeah, I know. Good. And then the other forms of Petrissage are the compression strokes. So you can start with just kind of feeling the compression. You can go around the joints and get an idea of what's going on here, which gives me already a reaction. You can use this compression and add a stroke to it, where you actually compress and then move away. Okay, here we go now. Go back. So compression, different areas to get an assessment, what's going on, and then you stroke. Good. If you go into the next part of the Petrissage stroke, it's called kneading. So you feed tissue into each other, into your hand. So you go deeper and you kind of really massage, you work on the deeper level of the muscle. The compression strokes you can also do with your knuckles. In Hawaii we even do it with our forearms, kind of lomi style. where you create more space. And always combine it with the Effleurage stroke. If you give a direction to the Petrissage stroke, to that kneading, you go into ringing. So you go in different directions and loosen up tissue. You can do that over areas like the leg. You can also do it over the withers or the back. Then another Petrissage stroke is the cross fiber friction, where you find a spot and you go perpendicular to the muscle fiber. You can do gentle or a little more vigorous. You have to really make sure that you're not over any nerves or sensitive areas. So you kind of help cross fiber friction to separate those muscle fibers by going perpendicular. And smooth it out in between, always with Effleurage strokes. We also have strokes where you compress the muscle in order to release it. So you compress the muscle origin to insertion, and you give the brain information that you stretch that muscle. The Golgi tendons in the organs in the tendons give feedback to the brain and tell the brain that that muscle gets stretched, and in order to avoid any ruptures, the brain releases signals to let go of that muscle. So you can go and grab a muscle where you feel it like super tight, and then you can squeeze it back together, like, and hold it so it lets go. That's not your favorite stroke, I know. So these are the Petrissage stroke: kneading, ringing, picking up the muscle, all the ones, skin rolling, vibration, and shaking. If an area is really tense, or it doesn't react too much, or you actually want to activate the muscles, you can go into the third set of strokes we have. It's called the Tapotement strokes. There's like 4 sets depending on how you use your hands. You start with flat finger. It's called panning. So you use, depending on whatever you want, you can do more or less. If you go around areas which are more prominent and bony, you change your hands into cupping. And you can see how you can release. If you have an area where the ulnar side of your hands are appropriate, then you can go into hacking. And gently, it's important to have loose hands, and gently release that energy. And then if we have really bulky, hard muscles, you can go and pound. If you hit the right spot, you realize that's not an area they really like. Here we go. Gentle, also loose hands, loose fists are important. So these were the most basic stroke for massage, and now the art of massage is to kind of bring those strokes together in a useful and nice feeling way. Thank you.